Welcome back. In our special segment with Health Boost with Sneha Mordani, as I bring her in, we talk about, has there been an exhaustion ever since the COVID pandemic, of fatigue that refuses to go, Sneha? A lot of people have complained they're not able to exercise anymore.
That's right.
They feel there are breathing difficulties. Is there a such thing as long COVID?
Yes, absolutely. You know, Pooja, it's playing out in different ways. It's manifesting itself in different ways. Long COVID is a reality. Unfortunately, how many of us are studying it? Very few studies in India. Now, CMC Vellore has done a study talking about, in a survey and in a study talking about how the lungs of Indians have been affected after COVID. Reduced lung capacity is a huge concern in India. Now, those people who are vulnerable continue to suffer long COVID. So, after you've recovered, by definition, long COVID is in fact a problem or problems that the body, various organs get affected in different ways. It could be chronic fatigue. It could be reduced lung capacity. In many patients, neurologists have spoken about a great deal of anecdotal evidence as to how it worsens cognitive abilities in senior citizens. And vulnerable, remember, those who have comorbidities, diabetes, hypertension, those who've been unwell, pregnant women, those people having COVID have landed up with long COVID, which means that there are symptoms and difficulties that manifest itself over a period of time, even weeks and months after recovery. I spoke about lung capacity. In India particularly, it has been seen that lung capacity of Indians, particularly those who suffered from COVID in the first wave of the pandemic, essentially, has come down. And long COVID, like I said at the outset, is a reality. Much more research needs to be done. Many more studies need to be done to actually get a real sense of how COVID has had a lasting and lingering impact on our health. I put together this report on chronic fatigue associated with COVID. Let's take a look. Well, have you been infected with COVID-19 in the recent past? If yes, then we have news for you. One that might want to make you stay a little cautious. Research done by the Center for Disease Control in the US indicates that people who recovered from COVID are at a higher chance of getting chronic fatigue. Now, what really is chronic fatigue? There is just so much chatter around long COVID. It appears that this has got to do with long COVID. Chronic fatigue syndrome is a disorder. In this, extreme fatigue is experienced for a period of at least 6 months. These symptoms don't subside with rest, while the cause of this is actually unknown. Experts believe that a variety of factors could actually be responsible for triggering this. According to the CDC, the Center for Disease Control, patients who are infected with COVID are 4 times more likely to develop chronic fatigue. Medical records of 4,500 patients were studied who had COVID between February 2020 to February 2021. Individuals were followed for 11 months and their health data was compared with 9,000 non-COVID patients having similar symptoms. Result, fatigue developed in 9% of COVID patients. Among non-COVID patients who had been infected with the virus in the past, the story was a little different. 68% were at a risk of fatigue and were also 4.3 times more likely to develop chronic fatigue. Fatigue after COVID infection was more common among women. Older patients with diabetes are also amongst them. People with a history of mood disorders and obstructive pulmonary disease are also at risk. Additionally, it was observed that of the 434 patients who developed fatigue, 25.6% were hospitalized. During the follow-up period, it was observed that 5.3% of COVID patients with fatigue died. Authors of the study have said that there is a need for public action to prevent infections like these, because it certainly isn't about one infection, it is about long COVID, which is a reality. Increased awareness about this could in fact lead to improving one's lifestyle. Clearly, COVID-19, the disease, the infection, and getting rid of it isn't enough. These are problems of long COVID that need to be addressed.